Hello, everyone. Welcome to my case study presentation. I hope you enjoy and learn something new. Thank you. So, I did this case study on a student at the elementary school in Syracuse, New York, that I am doing my internship at. Her name used in this case study is Anna Page Kirk, which is to, substitute for confidentiality. She lives at home with a family friend, which she refers to as her grandmother. Her mom recently received custody of her, less than a year, but her mom is in and out of the household because of her current situation with working out of town. And Anna, she also lives with her two of her siblings. She has an additional sibling, but he doesn't live in the household. Anna is the oldest of all the children that her mother has. Anna has no information or any relationship with any relative from her father's side because her mother is not sure um, who her dad is. And her mother moved away from her family prior to Anna being born, so she has no relationship with her mother's side of family either. Um, Most times she's surrounded by family friends, which are friends that her mother has, and her school family. Um, she's experienced some instability within her um living conditions because of conflict her mom has with her neighbor, and it's something that she finds very frustrating because the neighbor's children also comes to the school that she attends, and it sometimes causes issues. She leans on the support staff at school when she's experiencing any dysregulation, and leaves class during frustration, which she experiences a lot. Some concerns that we currently have for Anna is that she struggles with regulating her emotions in school, and she really struggles with building relationships that are meaningful with her classmates. She finds it easier to interact with adults and build a connection with them. She leaves class when she gets really frustrated and overwhelmed. She currently has a habit of putting anything in her mouth, especially when she's stressed. Her behaviors are greatly impacted by her home stability and on emotional functioning. Even with all that Anna is experiencing, Anna shows great strength, um, especially with seeking help from adults that she trusts. She reasons appropriately based on her age. She knows she is fully aware of right and wrong. She really appreciates when people are being really honest and transparent with her because she has experienced a lot of trauma with her mom telling her one thing but doesn't show up for her and stuff like that. So she really appreciate if you let her know exactly what you're going to do, and if you can't do it, the reason why you can't do it. And she really appreciate that. She shows openness to support and connection. So even though she struggles with building a good relationship with her peers, she's open to try to meet with them and do activity with them. She's greatly motivated academically and socially, but with her inconsistency in class, like leaving all the time, it really hinder her from doing extremely well in class. She displays insights into her feelings in simple terms, like she'll say, I'm sad or mad and stuff like that. But to explain her feelings in more in-depth way, she's unable to do that. Um, person in environment framework. Her behaviors are understood in the context of home stability, attachment disruptions, and anxiety. The stressors at home affects her classroom behavior. School is like her most stable force currently. Emphasis on understanding why behavior occurs and not just what behavior are happening. Framing question: how do environmental instability, trauma related stress and developmental needs influence Anna's emotional regulation, peer relationships, and coping behaviors in school? It guides assessment through a trauma informed from a contextual lens, centers the child's functioning within the school environment and social system, within the family and school environment and social system. The diagnosis that would be considered would be adjustment disorder with mixed disturbance of emotional and conduct. This is guided by the criteria from DSM-5, which are emotional and behavioral symptoms linked to identified stressors, distress beyond expected for her age, impairment in school functioning. Symptoms are are not better explained by another disorder, differential considerations, and anxiety disorders. Some goals for the treatment plan would be to develop emotional regulation skills, improve social skills with peers, replace unsafe coping behaviors, strengthen family and school support, and develop consistency. Um, the the intervention frame the intervention framework um would that we would use would be cognitive behavioral play, which will help her to identify feelings through play. She will build coping and problem solving skill. She will safely explore her experience. Also, school and family collaboration would be a intervention use, which she will learn how to share. We would learn how to share different strategies for her emotional support, develop consistency in routine and expectations, both in school and at home. The expected outcomes are on a page should be able to put a name to her emotions and further explain how she feels, manage the different emotions she's experiencing. Also, she should feel comfortable with interactions with peers. She should be able to increase participation and engagement in classroom activities. She should be able to adjust with an oral fidget. In the end, her prognosis should be good because she has shown strength, motivation, and responsiveness to support she usually receives. Questions that still remain are: how is Anna's socialization outside of school with her siblings? What are some specific strategies that might help with generalizing her coping skills from school to home? Are there any underlying developmental concerns that might contribute to her oral coping behaviors. Some recommendations for her future would be enrolling her in occupational therapy to help assess Anna's sensory needs, collaborating with mother and grandmother to help them learn to develop routines and emotional validation, creating peer groups with structured play, opportunity to practice new behaviors, conduct evaluation as Anna progress periodically, document Anna's home and school behavior and emotional communication, continue cognitive behavioral play therapy sessions to reinforce coping and social skills. To conclude my presentation, this study really highlighted how young children's behavior can be deeply shaped by their environment, emotional needs, and developmental stages. Having early intervention will help with building long-term resilience and help clients like Anna to thrive socially, emotionally, and academically. When you use cognitive behavioral play therapy and person in environment framework, it allows clinicians to support children like Anna through a developmental appropriate on a play-based approach that teaches emotional regulation, communication skills, and positive peer interactions. These are my references and the end of my presentation. Thank you for tuning in.